Welcome to Time for Health. I'm Rachel Fall, and I'm very glad you've joined us. As always, when we gather, we talk about a different health topic, and hopefully it's useful for you or maybe somebody you know. And I ask you to always share the information, and of course, never start or stop anything without talking to your healthcare provider first. So today we're talking about shingles and pneumonia vaccines. So I know vaccines are kind of a hot topic. We're not necessarily talking about the contentious ones, so to speak, but some different ones. So, and Josh Spayde, clinical pharmacist at Magruder, is our guest. Thank you for being here.
Of course, thank you for having me.
Yeah, so we're just going to talk about two today because I know there's a bazillion different vaccines out there.
True.
A lot of them start when we're young babies and everything, but these are a couple that adults maybe need to consider, and like I mentioned in the beginning, talk to your healthcare provider about, is it time for you or whatever. So the first one we'll talk about is the pneumonia vaccine. So I feel like I've heard different names tossed around for it. So what are some of the names of pneumonia vaccines that?
So pneumonia vaccines have typically been your Prevnar 13 or Pneumovax 23. And those are kind of differentiated by the number of different strains of pneumonia that they cover. So higher number is better. Ultimately, we want to get to that higher number full vaccination.
So, and actually, I think I want to back up a little bit because vaccines are for, so these aren't, I always try to, antibiotics are for like bacterial infections and vaccines are for?
We typically associate them more with viruses just because the
Okay.
flu, COVID, going more for viruses.
Okay.
Pneumonia is actually going after a bacterial infection.
Oh, okay.
So the pneumonia vaccine is trying to basically boost our immune system, make it recognize those bacteria that cause pneumonia a little bit faster.
Okay.
And it's also those that may cause, inner ear sinus infections, anywhere that kind of lives near that environment of the lungs and commonly causes pneumonia.
Okay.
And
Ages.
there are multiple ages, especially anyone over 65 should receive the vaccine.
Okay.
And even if they got vaccinated when they were less than 65, they're probably due for a repeat.
Okay.
And then less than 65, some of them are more childhood vaccines. From 18 to 64, it really depends on a conversation with your doctor and what other comorbidities or health issues you may have.
Okay, so anybody 65 and over should talk to their doctor and see if it's
Yes.
right for them, obviously.
Yeah.
But that's kind of when it's recommended the most, is when you really need to start having those conversations, is 65 and over.
Yeah, 65 and over, you need to make sure that you're fully vaccinated. Usually you're due for quite a bit, and then once you get those, typically you're good from there on forward.
Is a pneumonia, is it a series or is it just one and then you don't have to worry about it anymore?
It depends on whether, so as I talked about the Prevnar 13, Pneumovax 23, they also came out with a 20 strain and a 15 strain. So they're adding more complexity to it. It really depends on which vaccine you got at which age in order to know what kind of dose series you're on.
And that's not necessarily the layperson's job to figure all that out. That's why it's important to have that conversation with a pharmacist or a healthcare provider.
Yeah, and just about all routine vaccines, you're welcome to show up to basically any retail pharmacy, and they'll happily kind of look up your history on a database and figure out what we need to give you to make sure you're fully covered.
Okay. And pneumonia is like a respiratory thing and can be very serious. I mean, people can die from pneumonia. Is that being overly dramatic, or is that?
No, that's accurate. I like to think of it as we kind of learned with the the dinosaurs and everything else, that life finds a way and life wants to live until something proves it otherwise. And the same is true with these bacteria. They want to live. They don't realize that you're just a person trying to go about your life.
Right.
So if they end up accidentally causing you harm, that's just a side effect.
Yeah. And so if there's a way to prevent that from happening.
Yes. And so that's why we always try to prevent as much as possible.
Okay.
So we want to make sure that if there are vaccinations that we can give you to prevent pneumonia, shingles, COVID, the flu, anything that we can do to prevent you from getting sick in the first place is way better than trying to treat it after the fact.
Yes, I will agree with that. And how long has a pneumonia vaccine been around? Like long time. Like I feel like as long as I've been
Yeah.
an adult professional, it's been
Yes.
around. So 20 plus years at least.
They've come around with like new brands, new, as I said,
Numbers.
But the general consensus, usually you get some as a childhood vaccination,
Okay.
and then you're just due for a re-up as you get older.
Gotcha. And you said, whether it's one and done or multi, it depends on which one you got and what your healthcare provider. Okay, so pneumonia. And cost, I know that's like a can of worms because every insurance is different,
Yes.
and some people have Medicare and maybe they have different guidelines than what your insurance to your employer or Medicaid might have or something, but
Yeah, so Medicare, Medicaid, they are typically very aggressive in trying to prevent as much as they can. So they're usually very happy to cover your preventative vaccinations.
okay.
Commercial insurance, they do expect you to pick up a little bit more cost typically,
Okay.
but it totally depends on the plan. So coming to a pharmacy, we're happy to run your benefits.
Oh, okay.
It runs through the same prescription coverage that you get your medications under.
Okay. So that you can just bring your card into your pharmacy and they can kind of look it up ahead of time so you're not like, surprise.
Yeah, we can run a test claim through and it'll say what the cost is and you can decide yes or no. And
Okay.
if you want to try getting it at a doctor's office or a clinic somewhere else, then that's perfectly fine. We want to help you as much as we can.
Okay, awesome. I think you answered all my pneumonia vaccine questions.
Very
And,
good.
and like you said, the insurance probably recognizes that paying for a vaccine is less expensive than paying for the care of somebody.
Yes, getting
gets-
hospitalized,
yeah.
having your IV antibiotics, being in there for multiple days, and getting all the respiratory treatments. It's very costly.
It can be very costly.
Whereas this vaccine, which the insurance pays $100 to $200 for, probably, that's a deal for them.
That's a deal. What a bargain. All right, so shingles vaccine. I have known people who've gotten shingles and they say it is just the worst pain. So I guess talk about the same kind of thing. Are there different names for the shingles vaccine? Who needs to get it? All that stuff.
So the shingles vaccine, nowadays it's the Shingrix. It used to be Zostavax.
Okay.
So Shingrix came out in 2017, and it offers, they say, 90 to 97% coverage of
Nice.
preventing a shingles outbreak, whereas Zostavax was only about 50%. So we've vastly improved.
Yeah.
If you have not got your shingles vaccine within the past 5 years, then you would have had the old one, and you're
Okay.
basically due for a re-up.
Okay, so the new one's been around for 5 years.
Correct.
And so you can get it more than once. If you got the old one, you can get the new one. Can
Yep.
you get the new one and then do you need another shot of the new one?
So it's a 2-dose series.
Okay.
You take it once, and then 2 to 6 months later, you're due for your second dose.
Okay.
And whenever you get that in your lifetime, it protects you for the rest of your
Right.
life.
And it not, there's always the little 2 or 3 or 4% or whatever but maybe it makes it a little less severe if you
Yeah.
do get it down the road or whatever.
Yeah, and I mean 0% versus 97, pretty big difference.
I'm not real strong in math, but I got that one. Is there a certain age of when people should start talking about a shingles vaccine?
So actually, when it first came out, they were kind of restricting it. It was
Okay.
going for the older population. They've recently kind of dropped the recommendation, so you can get it down to the age of 50.
Okay.
And it is, so shingles itself is kind of a virus. Anyone that has had chickenpox,
Okay.
it's already living in your body. And it's just in times of stress and times, now's kind of a stressful time
Yeah.
in general. When your body is weakened, then it sees its opportunity and it comes out and makes a painful blistery rash, typically along one side of the body. It can involve anything from the abdomen up to the face. Very bad.
Yeah. That's what I've heard.
But anyone who had chickenpox previously, they are at risk. So we
Okay.
do really recommend it.
Okay.
If you had chickenpox, even if you had the chickenpox vaccine, it can potentially come from that. Basically, anyone 50 or older, you might as well get the shingles vaccine.
Okay. And again, the one and done or multiple. If you get the new one, 2 shots, and then you
2
don't
dose, and then
need
you're
it.
done.
You're done for the rest of your life. Oh, that's lovely. 50 years and older. cost, is it kind of the same thing as pneumonia, or is it a little bit newer?
It's a little bit newer, so it's not covered quite as well.
Okay.
Some insurances cover it just fine. Sometimes you do have to pay a copay. I've seen copays usually up to $150 is where it kind of caps out.
Okay.
But that's something that going to the pharmacy, they can run it for you.
Run a test claim and see how much it's going to be with your particular insurance.
Yeah.
Okay. So both of these, shingles recommended for 50 and over-ish. Pneumonia is 65 and over-ish, but if you have other things going on, you might want to talk to your doctor.
Yeah, pneumonia is 65 and older for sure. Less than that, it depends if you have, diabetes, chronic lung issues, if you have other medical problems.
Okay. All right. You've covered everything. Any last-minute thoughts that you're like, man, I wish people knew, for all the thousands of people watching it? Not really.
Oh, man, put me on the spot. If you ever have any medication questions or want to look up what vaccines you've had or anything, then any local pharmacy is happy to help out, whether that be the regular retail pharmacies or Magruder Pharmacy.
Inpatient, okay.
We just want to provide a service and make sure that we help the community.
That's awesome. I think that's a great nugget for any of the topics that we've talked about is, I know, please ask, just start the conversation, just ask the question in the pharmacy with your doctor, with your nurse practitioner, whatever. Awesome. Thank you.
You're welcome.
All right. So there you go. A little bit about the shingles vaccine and the pneumonia vaccine. It may not be pertinent to you, but maybe you know somebody who has health issues or is in that age range where it might be a concern for them. So take the information, share it with those that you know and love, and until we meet again, I encourage you to make time for health.